Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. So for this week's question, I actually got two very similar questions submitted separately. So I thought I'd just do both. The first one was, why do I love it when my female doctor grabs my balls during my physical exam? And the second was, why do I like it when my doctor, who is female, grab my balls? So let's first talk about why your doctor may be feeling your balls during a physical exam. This is a routine part of a physical exam, feeling your balls to try and detect any bumps or lumps. These can be a sign of testicular cancer. And just in case you're one of those people who associates cancer with the older population, testicular cancer is most often seen in men between the ages of mid to late 20s to early 30s. So it's important that you're having this check done. Just to let you know, doctors will also feel your balls if the appointment is to talk about erectile dysfunction. Just wanted to make sure people were aware of that before it happens. Getting aroused and having an erection during testicular exam is actually really common. After all, someone who's not your partner is touching your balls. And that feels good for many men. For some men, though, the whole thing is so awkward that they sometimes don't get turned on by the exam at all. So if you either get turned on or don't get turned on during a physical exam, don't worry. They're both natural reactions. Now, why you specifically love it or like it, that's something only you can answer. Maybe you've been really horny and now someone is rubbing your testicles. Of course, there's a good chance you're gonna really like that. It could be that you get turned on by the power dynamic of her being in control as a doctor and you being on the more submissive end as a patient. Maybe it feels a little taboo to be having sexual feelings in a place like a doctor's office. Maybe it's the stethoscope that turns you on. There could be a lot of reasons why you personally love it when a doctor feels your balls. You could always test out some of these to see what it is that turns you on. Maybe you and your partner could roleplay doctor and patient, complete with lap, coat, and stethoscope. Or you could play around with some different power dynamics and see if you can recreate those feelings you had at the doctor's visit. A couple words of advice for those times when you like your doctor feeling your balls. The first is to know that it's normal to enjoy it when it happens, and you may get an erection in these kinds of situations. Most healthcare professionals have seen this many, many times, so no need to feel awkward about it. The second is not to assume that the doctor has any sexual interest in you. They're a professional. Just let them do their jobs without any kind of harassment or inappropriate comments from you. And do me a favor, don't be that guy and send a thank you card the next day. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Threads. And make sure to check the description for links where you can submit your own sex question.